Here come the Hawks, the mighty.
Well, the Blackhawks are in round 2 playing the evil empire, the Red Wings. If a player gets hurt on the ice, you will see this man taking care of them. He will also be saving my life next week as he performs knee surgery on me. We'd like to welcome to the show the Blackhawks head orthopedic surgeon and my doctor, Dr. Michael Terry. And Doc, I say you're saving my life because I drink booze, and if I don't work out, I'll have a grabber and I'll die. You see how that works?
Yeah, I guess so.
How many patients do you have waiting for you today?
You know, we've got surgery today, so we've got 6 or 7 surgeries that we're going to be doing today.
What is your most important surgery this month, Doc?
Well, our most important one's going to be you, of course. I don't know if there's any question about it.
Doc, I have a few questions for you. I'm having surgery next week, and this weekend I go to Vegas, and I'll be there for 44 hours. I will be drinking for 38 of those hours. Will that affect me on the operating table next week?
Well, stay out of trouble when you're there, but, you know, our anesthesiologists are pretty good. I think they're going to take pretty good care of you.
I got to tell you, man, I walked into your office. You know exactly what's going on. You asked me a few questions. You're like, you got a torn meniscus, but we're going to do an MRI, and we'll see what it is. You were right. Because you've done this many times, haven't you?
Well, yeah, we've been doing this for a while, and you know, it's fun.
Can you explain to people what exactly a torn meniscus is?
Sure. Yeah. So the meniscus is a little bit of cartilage in the knee. It's a bit of a cushion cartilage in the knee, and it works to help prevent arthritis and wear and tear in the knee. And you can tear them, and they kind of can flip around inside the knee joint and cause some pain and some catching, locking. And so typically with a young, healthy, athletic male like yourself.
Thank you. I appreciate that. Thank you.
Yep. So usually those things are troublesome. And if they are, then we'll consider doing surgery on them to get them taken care of.
Well, the meniscus is the size of a quarter, right?
You know, probably if you think about something bordering a quarter, kind of running around the edge of a quarter, that might be a pretty good analogy. So just a little bit of a C-shaped, partial O-ring, basically, that kind of surrounds a quarter would be a pretty good size estimate.
So, Doc, do you go in, you sand it down, you have to sew it? What do you do?
It depends on what it looks like when we're in there. You will do both. If it's a tear at the periphery of the meniscus where it attaches to the rest of the knee, to the knee capsule, we'll sew it back together. If not, we'll smooth it out.
What's my recovery time, Doc?
You know, it's a bit variable until we know exactly what we've had to do in the operating room, but what we estimate for you is that we'll be able to get in and get you going. You'll be up and around in that day, walking that day, and progressing your activities to full athletic activity. I would say a month or two down the road, you should be doing what you want with little or no trouble.
We're talking to the Blackhawks head orthopedic surgeon and my doctor, Dr. Michael Terry. Now, you do so many of these on your surgery day. Is it like going to an ordinary job? Because I'm just curious how it works with a doctor. Because, you know, I go to work, I do some interviews, we have some fun on the radio, and that's it. I mean, you go to work. This is intense stuff.
You know, it is. I think you need to focus on what you're doing rather than some of those other things when you're in the operating room. But the operating room is a great place. We have, you know, it's a lot of concentration, but it's a physical activity, so you're doing different things. It's challenging. Everything's different. You know, even though we do a number of different surgeries consistently, everybody's different, and so it makes it a lot of fun. There's a lot of variety in what we do, and especially in sports medicine, you see younger folks and people of all different ages too.
What kind of music are you going to be playing next week when I'm under the knife?
You know, we mix it up a little bit. We'll play everything from 80s to rock to newer stuff. We mix it up a little bit. If you got a preference, we'll be happy to accommodate you.
Do you wear the floral hat in surgery?
I don't.
So it's not like Grey's Anatomy, you know, where you go in and there's a lot of drama. You just go in, you have some fun.
Well, yeah, we go in and we try to keep things, flowing and keep people happy. And it does get dramatic at times, you know, but I think those TV shows maybe a little bit more than real life.
I'm telling people in lieu of flowers, they can just send me money. Just send it directly to me, especially try to send it this week since I'm going to Vegas. I understand, Doc, that this comes with a playoff package and a finals package, right, of tickets?
Yeah, I got to watch what you're saying. I think that most of my patients will be ready for their playoff tickets if they come in this week. Now,
if people watch the Blackhawks, you are behind the bench in that little alleyway, and you have an earpiece in your ear. What are you listening for?
We just I record all your old shows and just put them on and let it flow while I go.
Nice.
You know, the earpiece is something we'll use, especially during the playoffs. It connects me to the guys on the bench, and so there's a plexiglass between us. But that just allows me to get word from them if somebody's coming off, needs stitches, or if I'm in the back sewing somebody up, then I'll be able to hear what's going on the bench.
Can you watch a player from where you're standing, since you've done this for years, and you could say, wow, that guy's just not skating right, I need to talk to him?
Yeah, for sure. We'll keep an eye on people. I'll go back and forth in the locker room and be able to watch the replays of any of the hits, and we do that stuff a lot too.
We all hate Detroit, the evil empire. We all hate the Red Wings. Give me a prediction for the series. We win in 5, we win in 6. Tell me.
I think that if our guys are healthy and we're playing the way we can play, I don't know if there's anyone who can take us to Game 6.
How great has this season been?
Yeah, it's been pretty fun. It's been pretty unbelievable, actually.
The franchise that saved hockey on the cover of Sports Illustrated, it was like, oh my God, this is going to be another magical season.
We're hoping for the best in this second season here, and the guys are ready, and playing Detroit should be a lot of fun.
So you're in Chicago, you fly out with the team, you fly back, so you're going back and forth.
Yeah, a little bit. That's one of the, when I was watching the last round of the playoffs, it was going to either be West Coast or Detroit, and
right.
And it makes it a lot easier for me if it's closer to get back and forth.
And final question, very serious here. Who wins in a fight, Seabrook or Coach Q's mustache?
Yeah, that's got to be a coin toss. I think both of those are going to be pretty tough to beat.
He is the Blackhawks head orthopedic surgeon and my doctor, performing knee surgery on me next week, Dr. Michael Terry. Doc, I'll see you next week. Thanks so much.
Yep, we'll see you then.
All right, talk to you soon.
Take the attack, yeah.